Come in.
Hello, Mr. Hernandez. Do you have time? I have something to ask.
Yes, sure, come. Have a seat.
Actually, I want to ask you about Fear Questionnaire. Can you please explain to me how to administer it?
Hello everyone. This is Fear Questionnaire. Fear Questionnaire, FQ, was published in 1979, which includes one specific main target phobia, a global phobia rating, and a short questionnaire about the commonest 15 phobias and 5 associated anxiety-depression symptoms found in clinical practice. Developer of Fear Questionnaire are M. Marks and M. Matthew, both are psychiatrist and psychologist from London. This is a self-reported assessment, and the purpose is to measure severity of and change in common phobias and related anxiety and depression. The target population is people with phobic disorder, and is a contraindication for patients who have no insight and self-awareness. The component assessed are agoraphobia, blood injury phobia, and social phobia. It only takes about 10 minutes to administer. But, how to administer? Step 1. Client need to choose a number from the scale, 0 to 8, to show how much he would avoid each of the situations listed below because or unpleasant feelings. Next, choose a number from scale, 0 to 8, to show how much they are troubled by each problem listed. Step 3. Client need to rate the present state of their phobic symptoms based on the scale, 0 to 8. Scoring procedure. Every item score Likert scale range from 0 to 8. Main phobia level of avoidance in item 1, score range 0 to 8. Total phobia score, sum of items 2 to 16, score range 0 to 120, associated anxiety and depression, sum of items 18 to 23, score range 0 to 40, and global phobia rating in item 24, score range 0 to 8. For interpretation, there is no cut-off score, the score for each subscale used to compare pre- and post-intervention. The higher the score, the higher the level of avoidance or the level of troublesome. Psychometric properties. Fear Questionnaire has moderate convergent validity. It also has moderate to high internal consistency, and good test-retest reliability. For strength, FQ has good reliability and validity, wide clinical appeal, easy to complete. Patient with agoraphobia can be discriminated from patient with social phobia. For limitation, FQ do not provide the amount of clinical information necessary for treatment planning. The scale's 5 items are only rated for avoidance, and each items show different total score. Fear Questionnaire is suitable to be used in Malaysian population because the items are relevant.
This is the assessment. So let's say you become the patient, and I will be the therapist?
All right, sure.
Hello, Mr. Damien, I'm Hernandez, your therapist for today. So, how's you come here? Are you alone?
I took a bus to come here. And yeah, I'm alone.
All right, it's okay. So, I want you to answer some questions in this paper. Don't you worry because this session's confidential. Trust me.
Okay. I should put my name here. All right. Choose a number from the scale above to show how much you would avoid each of the situations listed below because of fear or other unpleasant feelings. Oh, okay. Then, write the number you choose in the space opposite to each situation. Now choose a number from the scale below. To show how much you are troubled by each problem listed, write in the space opposite. Yes. Done.
Oh yeah, you are great, Mr. Damien. So it's time to calculate that questionnaire. We also must to interpret it together. Here it is. What we have to do is to identify the 4 scores are obtained from the fear questionnaire. First is the main phobia level of avoidance at the item 1. Second, the total phobia score, sum of items 2 to 16. It's divided by 3 subscale. Agoraphobia subscale. Blood injury phobia subscale. And social phobia subscale. Third, a rating of associated anxiety and depression. It is obtained from 5 common non-phobic symptoms found in phobic individuals, questions 18 to 22. Fourth, a global phobia rating at the final scale. It's reflecting distress and avoidance. Wait a minute. If you realize, there are 2 items excluded from the scoring. Item 17 and 23. Yes, these part are for therapists to do further evaluation. Then, we calculate all the items. For main phobia level of avoidance, he get 8 score. Next, a total phobia score are calculated by adding all the 3 subscales. Agoraphobia items score about 18. 24 score for social phobia items. And blood injury phobia items score 20, so we get 62 for total phobia score. For associated anxiety and depression, score 19. And the last one, global phobia rating, score 5. Fear questionnaires show different total score for each item. So, from the result we can conclude that Mr. Damien have social phobia symptoms, as the score for the item is the highest. There is no specific interpretation for this assessment, but we can see patient progression by compare the X result before and after the intervention program. That's it, easy right?
Oh, it's so easy.
Yes, Damien.
Thank you, Mr. Hernandez, for your help.
You're welcome.